we will do our very best to bring something to your meeting today. And I look forward to shortly turning things over to my great friend, Albert Oriel. With that, what I'd like to do is just share a few thoughts with you all, a little bit about myself. I've spent my entire career in health IT, really the last 2 decades, working very closely with healthcare CIOs and health IT executives and other digital health leaders to elevate the profession, as well as to work closely with organizations like HIME and Schneider Fabric to improve health and care in the global communities that we all serve. CHiME as an organization is a not-for-profit professional organization. We're here dedicated exclusively to serve and support the professional development needs of health IT leaders, and truly to be a leader in digital healthcare transformation as well. We are a global organization connected through multiple communities, and we serve about 5,000 health IT leaders. And we're most pleased to partner with HIME and Schneider Fabric, really to work hand in hand to improve digital health leadership across the entire German speech community as well. I know all of you are in a pretty incredible digital transformation journey right now, and you have CHiME's commitment to work closely with you to help serve and support you on that transformation. One of the most important responsibilities at CHiME that I have is to look for opportunities to partner outside of the United States and to help accelerate the advancement of digital health leadership and transformation. And it has allowed CHiME to work very collaboratively with health IT executives in more than 58 countries and entirely across the healthcare continuum of care. Importantly, it has helped lead to this amazing partnership that CHiME has with HIME and Schneider Fabric, and we couldn't be more pleased. I'm going to go back a few years here and talk about where this partnership began, because I truly think it's worth reflecting on the power of partnerships in the community that we can bring together to help really improve health and care wherever we live and serve. HIME and Schneider Fabric and CHiME first came together back in 2019. There's a photo that you see there of us at Schloss Diek. That was the very first international certified healthcare CIO or CHCIO prep course and certification exam. And we were thrilled to be there with you all and those amazing leaders who took that very first prep course and exam and now are certified healthcare CHCIOs themselves. But we've come a long way since 2019.
Keith?
Yes, sir.
We don't see your slides.
Oh, no. Oh, no. Sorry, Pierre. One moment.
But it was so far, everybody, I understand you. But
yes.
Now yes, I recognize that because I know his slides.
There we go. Let's see. Better?
Yes, now it comes. Yeah.
Okay. Okay, very good. My apologies. I thought I hit the button.
No, yes, this is the photo.
Yes, this is the photo. This is the photo that I was reflecting on. Again, this is the very first international CHCIO exam conducted in Germany, and it was an exciting opportunity for us to really work hand in hand together and reflect on that power of that partnership. But as I was saying, we've come a long way since then, and we've continued to work together and build on that community and build on the strength of that partnership. And I get asked this question quite frequently: why does CHiME partner outside the US? And I think it's important to reflect on the fact that together we are stronger and can certainly achieve much more together than we can alone. This digital healthcare transformation that we're all part of, it's getting more and more challenging, more and more complex every day. And to the extent that we can work together to make some of that transformation easier, less complex, lean on each other and learn and share together, we're all going to be significantly better off. So I'm here to say I really, truly support this notion of developing a global community of health industry leaders. I do believe that helps accelerate the sharing of knowledge and, more important, getting digital health solutions where they need to be. So with that, we've done quite a bit since that initial exam in 2019, and I want to share some of those achievements with you. One of the first opportunities that we undertook together was to really raise the bar for professionalism for healthcare CIOs across the German-speaking community. And again, that effort led to that very first International CHCIO exam in 2019. CHCIO, or Certified Healthcare CIO, started back in 2007. At that time, CHiME had developed truly the benchmark certification program for healthcare CIOs. And we've continued to extend that around the world. We have more than 800 globally certified CIOs since then. And I'm very proud to say, with some significant help from Pierre and many colleagues, we've been able to take that exam and culturalize it, regionalize it, and translate it into German, which has been the key to certainly expanding that particular program. Again, the industry is changing so rapidly. You all know this because you work in it every single day. It's important, therefore, that we all stay current on those changes. And the CHCIO certification is no different. It is not a static program. It is constantly changing. The framework is constantly changing as we continue to assess the skills, the experience, the capabilities required to be the very best CIOs that we can be. And again, it's taken a lot of hard work to get there, and we're very pleased with some of those achievements. You'll see at the bottom of this slide here, I've acknowledged we already have 35 CHCIOs recognized in the German-speaking community, and that's quite an accomplishment if you look back on the last few years when we've been in the middle of this global pandemic, and yet we've still been able to work together and acknowledge and accredit these amazing leaders. And it's certainly taken a lot of work to get there, but there's more work yet to be done. And I know as a result of the Hospital Futures Act, that your industry is under a massive transformation, is changing rapidly. And as a result, our solutions providers also need to change with those times. They have to make sure that they have the right skills, leadership, partnership, so that they can serve and support you on this transformational journey. Healthcare, especially healthcare IT, is full of risk. And anything that we can do to help de-risk some of those efforts, it's critical, particularly on this digital transformation roadmap. And I'm pleased to announce and share the launch of a brand new credential. It's called the Certified Healthcare Strategic Solutions Partner Credential. CHSSP provides an opportunity to identify and acknowledge those solutions providers who are truly partners, who are invested in transforming care in the German speech community, and not just there to implement a quick solution, or not just there for the short term. They're truly committed to partnering with you on this transformational journey. So we're excited for the launch of this new accreditation program, and we look forward to continuing to get your feedback and help us understand how to make this as great a credential and a certification as the International CHCIO has been. But there's more. Many of you have participated in the decision maker trip to the USA that typically takes place in the summertime. I know typically around July, and includes a number of visits and meetings with our health IT leaders in hospitals and health systems in San Diego, California. Exciting changes are ahead for 2023. And thanks to Pierre and HIME and Entscheider Fabric for working with us. The Decision Maker trip is actually going to include 2 exciting locations. Yes, San Diego for its beautiful weather, but more importantly, an opportunity to meet with those healthcare leaders and learn and share together, but also Phoenix, Arizona. And if you haven't been to Phoenix, Arizona in the USA, you're in for a treat. It is a lovely area, wonderful temperatures, but more importantly, includes an opportunity for that delegation to participate in the CHiME 23 Fall Forum. And the CHiME 23 Fall Forum is the most significant meeting and gathering of health IT leaders anywhere in the world. And we couldn't be more pleased to welcome the Decision Maker delegation next fall to Phoenix, Arizona. And again, Pierre, I want to thank you personally for all of the hard work you put into making this happen. And again, I think it reflects the power of the partnership and what we're able to do together that is much more difficult to achieve alone. With that, I close where we started, reflecting really on the power of partnerships and community and those deep relationships that are lasting. Through those relationships, we're able to have a much stronger impact together in advanced digital health and digital health leadership. We truly believe that working together still yields the best results. And together, we can transform health and care by aligning knowledge, sharing knowledge, and closing those digital gaps. With that, we absolutely look forward to closely working together with our German colleagues to improve health and care anywhere in the world. My time is up. I want to move quickly to our next speaker, Albert Oriel. Albert is not just an amazing CIO, which he certainly is. He's the CIO at Rady Children's Hospital and Health Center in San Diego, California, but he's truly a friend and somebody that I admire, and I look forward to hearing more from him. So with that, Albert, I will stop sharing my slides and I'll turn things over to you.
All right. Well, thank you, Keith. That was very kind of you. And thank you, Pierre. Guten Tag, everyone. It's the afternoon for you all. It's morning here in San Diego. A cold one for us. We're not used to. It's about 4 degrees this morning, which is unusual. So crisp, but beautiful blue skies, and I'm sure we're going to get up into the 15, 18 degrees when it comes down to midday. So it's all good. Can you all see my slides?
Yes, Albert, we can see your slides.
Well, thank you for having me this morning. I'm going to spend a few minutes talking to you about health information exchange in San Diego, and then I'm going to show you a couple of other cool things that we do at Rady Children's, because health IT has got to be fun, and so we'll share a couple of cool things here. So, what do I want to tell you about? So, if anybody were to take a guess, this was Rady Children's Hospital when it first started. I'm giving you a little bit of context. For us in the U.S., this was a long, long time ago. When I put my my European hat, I know this was basically yesterday, but back here in the States, it was a long time ago. This was 1954, and this was the humble beginnings of Rady Children's Hospital. Fast forward to 2022, and what you see is we've built a pediatric health system that is not only the safety net, but the provider of choice for pediatrics in a region comprising about 1 million kids, including San Diego County, Imperial County to the east of us, and Southern Riverside County to the northeast of us. So we've got 44 locations between inpatient locations, specialty outpatient clinics, and primary care clinics in our Rady Children's Health Network. We have about 505 hospital beds. Most of them are in our main campus. Some of you have been here during the Riser visits in the summer, but as some of you know, many of them are in adult hospitals where Rady Children's basically takes over the neonatal ICUs and the pediatric floors, and basically buy ancillary services from those hospitals, but we extend our electronic health record there. We put our nurses, our physicians there, and are in charge of providing that care in 7 community hospitals in the region, in addition to our own. We've got over 800 medical staff members. About half of those are pediatric subspecialists, over 5,400 employees. Last year, we did over 280,000 specialty visits and over 460,000 primary care visits in the outpatient space, 18,000 discharges, 18,000 surgeries, over 100,000 emergency department visits. And as you can see here, it's hard to read because it's very small, but it's almost 90% of the kids in San Diego are seen at Rady Children's, at 62% in Southern Riverside and 63% in Imperial County. But that is our context that we live in. We are affiliated with UCSD, University of California in San Diego School of Medicine, where the pediatric department basically is located here, and all their pediatric students and residents and fellows come through our doors. We're gonna move on now that I've given you a little bit of context about Rady Children's to this history, if you will, around health information exchange in San Diego, because San Diego was one of the pioneers in the U.S. around health information exchange. And this started with these two gentlemen that you see in the picture, Doctors Anupam Goel and Ted Chan, who were emergency physician. Ted is an emergency physician at UCSD. Anupam was an internist at UCSD. He's now a CIO elsewhere. But they put in a grant for this Beacon Community Program that the federal government was touting back in 2010, and came and knocked on the doors of all the large healthcare providers in San Diego, and told us we think that health information exchange is going to make a big difference in the care of our community. And for once, we would love it if you all would sign up for this. And lo and behold, every single healthcare system in San Diego, no matter how fiercely they compete, and I should say that we have the benefit of being the Switzerland of pediatrics in San Diego. We play with everybody, we're partners with everybody in the community. And it was an easy decision for us to make. But for some of the big adult hospitals and health systems, it was not an easy decision because they're in fierce competition with one another. But it was clear that this was the right thing to do for our community. And so we all held hands and provided backing to this grant proposal. And lo and behold, Doctors Chan and Goel got the grant. And this initiative started in 2010, the Beacon Community Grant in San Diego. And 3 years later, when that grant money ran out, it was the health systems in San Diego, as well as the county, that decided to continue this effort to fund a standalone entity to enable health information exchange, and that became known as the San Diego Health Connect. And that has been in effect until today. Fast forward to 2022, and as of this fall, San Diego Health Connect has merged with 211 San Diego, which was a parallel community information exchange for non-healthcare data. So San Diego had two separate entities, one dealing with healthcare information, one dealing with non-healthcare information. And now those two have come together, and now we can expand what we do. So in the past, these were all the entities that exchanged information in San Diego: hospitals, public health entities, school, primary care clinics, dialysis, ophthalmology. We had some long-term, not many. This is one area where there's a lot of opportunity still across the country, frankly, not just in San Diego. Federally qualified health centers, the community health information exchange, imaging centers, pharmacy, EMS, health plans, doctors, etc. So these are all areas. And through the community health information exchange. Now we're beginning to get to social agencies, and these are groups that offer Meals on Wheels for families that need assistance with food or social services or psychiatric support or other types of services. So this is incredibly important and where we're going. The types of services, you can see them here. I'm not going to go through every single one of them, but think of this as a provider directory, if you will, as an entity directory, a patient locator service, and then all these services that were provided. And what we're seeing is that with time, a lot of these things become now in the realm of the electronic health records. It used to be in 2010 that these facilities were not native to our electronic health records, so we needed intermediary tools to provide them. But nowadays, modern electronic health records like the Epics, the Cerners, the Athenas of the world, etc., they all provide these facilities natively, and so we've been able to scale back the services that go through San Diego Health Connect and been able to rely more on the native functionality on our respective EHRs. And then there are other services that are still of value in the community information exchange, and so we do those. And of course, this thing at the bottom, the social determinants of health type of information, this is what we are gaining now with the merge with 211 San Diego. And so we're very excited about those because we think a lot of the impact that we can make in kids for us and adults for the rest of the community comes from that interaction with the social fabric of the community and those agencies that provide other support that is so critical to maintain good health for those who are most vulnerable. So we're very excited about that. Our evolution has gone from a health information exchange portal to adding functionality that enables our emergency medical services, our ambulances, to connect with emergency rooms as they pick up a transport and they care for them, so that when that patient arrives to the emergency room, the clinicians there are ready to go. They have all the information they need, and they can narrow down the time that it takes them to respond, and that's been very effective in our community. We have public health reporting. This is something that through the pandemic has evolved. It used to happen at the county level. Now it's happening at the state level. And it's not just the public health reporting, but the syndromic surveillance and the immunization registry. So lots of incredibly valuable stuff, as you can imagine. Some of this stuff is very political with all the agencies that are involved, etc. But ultimately, I think everybody understands that exchanging health information is something that is critical to preserve the health of our community. It's the best thing that we can do for our patients in our community. And one way or another, everybody manages to come together with a solution that makes sense. Specifically for Rady Children's, this is what we look like. We exchange information with all 50 states. As you can see in the map here, of course, most of the volume that we do as far as health information exchange happens within California. This this last year, we exchanged almost 5 million records. Since our health information exchange program started, we've exchanged over 17 million records. You can see on the right the entities with whom we exchange, and as noted, most of them are actually, all of these are in California, most of them local here in San Diego. But we do this, and this is data through the EPIC Care Everywhere information exchange. But as you can see, we exchange records with other electronic health records, and you see here the other entities on the left: NextGen, eClinicalWorks, Athena, Commonwealth, which is the Cerner Health Information Exchange, Note2, etc. So Health Gorilla, you name it. So the capability is there to interoperate across platforms, and that makes a big difference. And the exchange has now gone beyond purely clinical data. We also do referrals, and as you can imagine, because we partner with the neonatal intensive care units in our community, often we see referrals that come our way when those patients need to see a pediatric subspecialist, and vice versa. When our kids age out, they turn 21 or what have you, and they need to go back to the adult, or they need to go into the care of the adult health systems, then we enable that referral back into those entities. So that's something that's become very useful and much appreciated by not just our families, but also our providers and the staff that support them, streamlining those processes that in the States are very bureaucratic. So what that means is that, at least for the time being, in which way we exchange data is becoming more of an and, not just an or, right? It used to be early on that we did this through a third-party entity, San Diego Health Connect. There was a time when folks thought that it was going to be only the EHRs that were going to be used to exchange information. And what we're seeing now is that it's an and, not an or. There are functions that are best served by different entities. We might get to a place in the future where the EHRs are able to take care of everything, but we're not there. There's one other type of exchange that we do, and that is relying on our direct access to information through our patient portal. And this is our patient portal. For our patients, we've got 450,000 patients. It's more than that because this data is from the summer, but about 450,000 patients with MyChart accounts. And as you can see, those that see us frequently, they are very active on MyChart. You see 85% of them are active on MyChart if they see us, if they've seen us more than 3 times. So that's functionality that is used, appreciated, and it gives the patients access to the record. They can also export it. They can share it with whoever they want. Last but not least, and this is the next frontier, and I'm going to tell you a short story here. Our I want to say it was around 2010, maybe 2012, when Josh Grommel, our now associate CIO, and myself are meeting with Jim Perry, who's the head of the electrophysiology program here at Rady Children's, and we're talking to them about these new technologies that enabled EKG functionality remotely using cell phones, etc. And as we're talking to him, he's looks like he's not paying attention. He's doodling on this piece of paper, and I realized that maybe this is not something that interests him. And I said, Jim, if this is of no interest, no worry. We've got other things to worry about. He said, no, this is very interesting. Hold on. He finishes his drawing and he turns it around and shows me this picture. Says, see, what you're telling me is I'm this surfer dude on the beach here, minding my own business, and I'm going to get this tsunami of wireless data that is going to come my way, and it's going to be on me to discern what is relevant and what is not. And if I miss something, it's going to be on me. So I need your help to help me make sense of this data, because I think this can be incredibly useful, but it could also be the thing that drowns us. And so we got to work on this, and I think this is the next big thing in health information exchange. And it's going to be challenging because there is a complete lack of standards. Every vendor provides information in their own way across various devices, etc. It's hard to set this up because we're not at a place where it's plug and play yet. Different devices have different capabilities as far as connectivity. There are security concerns, and ultimately we're dealing with a needle in a haystack situation. And so this is our next frontier, but we think that the future of health exchange is going to come through the integration of all these devices that help us to monitor the patient and their environment, right? Whether it's weight monitoring or heart monitors or glucose or the quality of the air in the house or asthmatics or oxygen saturation or medication adherence, what have you, or just exercise trackers, right? All this information can be useful if we're able to consume it, but this is the challenge that's coming for us, and we're beginning to see things emerging where people are aggregating this and trying to make our life easy, but we just can't, at an individual level, each provider put in all the effort to integrate these things one at a time with the lack of standards that exist today. So big effort for us coming forward. Now, I'm going to pause here and I'm going to do a bit of a 360, and I'm going to take just a couple of minutes to talk to you about a couple of cool things. And some of you who know about Rady Children's know that one of the things we're best known for is our efforts around genomics and our Genomics Institute. And what I can tell you now is that we are now at a place where we've built our partner network to over 80 hospitals across the US and a couple of international locations as well, where people send us their genomic data so that we can analyze it and get back to them. And our efforts are not just on the provision space, but also in helping to change how this aspect of care is recognized so that it can get reimbursed. And you can see that we're beginning to add color to the US map, working with various states in California and Oregon, we're there, Michigan, and Wisconsin. Oh no, Minnesota. Sorry, not Wisconsin. Got to get my geography right. And we have Louisiana. We have Florida and Pennsylvania, where those that legislation is in progress to try to make policy changes to ensure that genomic medicine gets reimbursed. So lots of efforts on this front by our Genomics Institute, trying to change the way we do medicine in the future. And since we started the Genomics Institute, and it got funded in 2014, but it really didn't start operations in earnest until late 2015, early 2016. We've done over 4,000 whole genome sequence to date, and really increased the effectiveness of it. But where we're on now is this effort to change the way we do newborn screening, to truly go from kind of 60 or so known diseases that babies get screened in today's world, to really looking for thousands of disorders that are known, that have known treatment paths. And so this is our big moonshot effort. We're partnered with a number of other institutions in the U.S., eventually internationally, on this beginnings effort to really change the way newborn screening is done, which we think is the way of the future. And so stay tuned for this, but this is really something that we feel passionate about. We think it's going to change the way babies are cared for, and from day one, and so we expect to see a big impact on this front. Changing gears, another cool thing that I wanted to show you, and I think those of you who attended the spring conference this last spring heard me speak about this a little bit. Dr. Justin Ryan, who runs our advanced 3D imaging lab here in San Diego, and has done tremendous work with his team on helping our clinicians to do precise surgical planning, to help with education, not just of the clinicians, but also the families and the patients. And now he's taken the cool stuff that we do here one step further, and I'm very excited to let you all know that this toolkit that he's put together with his team is basically available now for download, for those who want to be able to take advantage of 3D imaging, and it's basically a DICOM conversion software that we've produced here at Rady Children's, and that we're making available worldwide. Media to DICOM is the name, and you can see in the slide the link to it. So I encourage everyone to take a look, and Dr. Ryan is fantastic. He's always happy to partner and collaborate with others. And so if there's any interest on anybody's part, don't hesitate to reach out to him directly or through me, and I'll be happy to put you in touch. And with that, I think my time is up. I'm happy to answer any questions you may have. And I want to say vielen Dank for letting me share some of the cool things we do here at Rady Children's. And I really look forward to seeing many of you in the spring.